All right, the veil has been lifted and it is 9 p.m. across the territory of Kenya, and live from the Nairobi, the capital of Kenya, it is just time for you to join us for the Ebru Prime Time News. My name is Emmanuel Kutosi, and we've been up and about to compile for you reports on matters happening in the country and also beyond our borders. Also in tonight's broadcast, be sure to enjoy the treat of a discussion around universal health coverage with our very key spokespersons from the NHIF, who will be sharing on us the importance of ensuring that you are part of that program. But for now, let's get a preview of tonight's top stories. President William Ruto chairs a crucial meeting with the country's 47 governors in a bid to break a stalemate over the equitable share revenue and other burning issues.
I think we have a duty, we have a responsibility to work together, and I say work together in a very profound manner. Each and everyone seated here was elected by a majority. But there is a minority that did not elect us. And we have a duty to serve those who elected us and those who did not elect us.
The Jubilee Party suspends Jeremiah Kioni as its Secretary General and allegedly resolves to leave the Azimio coalition.
Kauli ambayo tumeafikiana leo ni kwamba Secretary General Jeremiah Kioni, kwa sababu ya utepetevu na ulegevu kwa kazi, kwa sababu mimi ndio naibu wake, hajaitisha mkutano, amekuwa akiendesha chama kwa kiimla, akiweza akisurutisha pia wabunge ambao wamechaguliwa, na tayari sisi tulikuwa tumezama. Hatua ambayo imechukuliwa kwa sasa ni kwamba amewezwa kuwekwa kando kuchunguzwa kwa madai hayo ambayo yameweza kuletwa mbele na wajumbe.
Azimio la Umoja has upheld its position that it will not tolerate any acts of betrayal from any of its elected leaders. Indeed, and it is a blessing to be alive. Welcome to the broadcast that is also streaming live on www.ebru.co.ke, and also receive the invitation to join us on our social media handles at Ebru TV Kenya across all social media platforms, and you can reach me at _Emmanuel Kutosi. Now, President Dr. William Ruto, alongside his deputy Rigathi Gachagua, today meet with governors during the 9th National and County Coordinating Summit in Naivasha, Nakuru County. The meeting coming amid a financial standoff between the county heads and the government. The county bosses have been decrying ballooning debts in counties and a backlog of payments that have been pushing for the increase to allow them clear the pending bills and facilitate service delivery to Kenyans.
President William Ruto has committed to timely disbursement of funds to county governments. He said this will hasten devolution and smoothen service delivery. The president noted that the devolved units of administration are at the center of Kenya's development. He pledged to work closely with counties and scale up partnerships, particularly in agriculture, security, health and housing.
We also pledge to collaboratively explore and develop mechanisms to improve the capacity of devolved units to generate own income, thereby mitigating the vulnerability arising from the reliance of transfer from the national government. Further, we have undertaken to ensure that the transfer of revenue is timely, predictable, and fully complied with by law.
He was addressing the 9th National and County Coordinating Summit that is taking place in Naivasha, Nakuru County. Deputy President Rigathi Gachagua, Council of Governors Chairperson Anne Waiguru, National Assembly Speaker Moses Wetangula, Senate Speaker Amason Kingi, Attorney General Justin Muturi, governors among other guests were present.
I'm delighted to be here today participating in this consultation on how the two levels of government can relate better, work better, find better solutions to local and national challenges, and truly deliver better services and better governance to our people.
Your Excellency, I wish to assure you that all the action points for the Council of Governors arising from the Nanyuki meeting have been implemented. This will be demonstrated in the first session today.
Your Excellency, your policy direction on this matter has been cascaded downwards to our national government officials in the counties, and I'm happy to report to you that in my various engagements with the governors, they have confirmed that our officers on the ground are properly aligned, and they have embraced the governors and the county government, and work is going on very seamlessly.
The president asked the leaders to endeavor to enhance harmony amongst themselves, unite and routinely engage. He explained that the culture of hostility, confrontation and litigation is disruptive, inefficient and wasteful.
I think we have a duty, we have a responsibility to work together, and I say work together in a very profound manner. Each and everyone seated here was elected by a majority. But there is a minority that did not elect us. And we have a duty to serve those who elected us and those who did not elect us. And no Kenyan should be punished because they went to vote.
On his part, DP Gachagua said it was the focus of the government to ensure devolution succeeds.
We have court cases between the county government and the national government, which is self-defeatist because the lawyers on both sides are paid from the public coffers.
He noted that through cordial and constructive engagements with the national government, counties have the power to transform the country. Samson Jura, Ebru News.
Congratulations to the contribution of each and every member of this summit, getting the confidence of your counties.
Now, insurance crime detectives attached to the Insurance Regulatory Authority have arrested a man for receiving 600,000 shillings from UAP Old Mutual Insurance after allegedly he faked the deaths of 3 of his relatives. Now, the detectives says Philip Odero Kauma lodged a false insurance claim with UAP Old Mutual, purporting that the 3 beneficiaries he had insured had passed on and received the payment between July the 2nd, 2021 and November the 19th, 2021.
A man has admitted before a Mombasa court to have obtained 600,000 Kenya shillings from an insurance company after faking deaths of his family members. Philip Odero Kauma, who was arraigned before resident magistrate Honorable Viola Muthoni, was charged with 3 counts of obtaining money by false pretense and 1 account of an attempt to obtain money by false pretense. In the first count, he admitted obtaining 100,000 as the last expense claim from the insurance company on the 2nd of June 2021 at Mwembe Tayari within Mombasa County by falsely pretending that Veronica Anyango Odero died on the 16th of June 2021. In the second count, Kauma confessed to have obtained 100,000 Kenya shillings as last expense claim from the same insurance company on the 2nd of September 2021 by falsely pretending that Benedetta Makanda Kauma is deceased. In the third count, he admitted receiving 250,000 on October 5th, 2021 by again falsely pretending that Benedetta Makanda Kauma is dead. In the fourth count, Kauma attempted to receive 500,000 Kenya shillings as last expense claim on the 5th of October 2021 by falsely pretending that Sarafina Anyango Juma had died on the 30th of August 2021. Mr. Kauma's payment, which has since been flagged as fictitious, came in the year that the insurance industry fraudulent claims hit 463.15 million, the highest since IRA started making public the figures. The value of uncovered fraud in Kenya's insurance industry was at 327.79 million in 2020 and 386.3 million in 2019 and 310.49 million in 2018. IRA is yet to make public the figure for last year. Prosecution counsel Mohamed Yasir prayed for more time to conclude the investigation and enable him to read the facts of the case. The matter has been fixed for mention on the 13th of February 2023. Samson Jura for Ebru News.
Thank you, Samson Jura, for that report on matters concerning that particular matter where one actually decided to be one who would actually not be truthful in what he was doing. Now, police officers in Eldoret, Uasin Gishu County, have launched investigations over the death of a person who was found dumped in an annex estate of the outskirts of Eldoret town. Now, the area chief, David Kiplagat, denied the allegations from the locals who claimed that the person was a former police officer.
Kutokea last year, mwezi wa 12, mambo imebadilika, mambo imekuwa mbaya. Wasichana wanauliwa, vijana wanauliwa. Unapata mtu amebebwa kwa bodaboda, anadungwa visu akibeba abiria nyuma ya pikipiki yake. Yani mambo imekuwa mbaya kabisa, hatuna security. Alafu tena hapa library haikuji huku. Langas ndio inaweza kuja ama Kiambaa. Sasa hata tunashangaa kama mkubwa ndiye anaweza uliwa kiunyama hivi mpaka nadungwa visu. Na sasa sisi wadogo ama hao wadogo watakuwa vipi? Nani watawalinda? Sasa hapa tunahofia hata usalama ya watoto wenye wanaenda shule, wengine wanasimama saa 10, wengine wanatoka hapa wanarudishwa late. Sasa unashangaa kama mtu mkubwa ndiye anaweza uliwa huko kiunyama, na hao wengine watakuwa wapi? Na saa zingine hata watu wa boda ndio wanatuokolea. Na saa zingine umetoka job late, hao ndio unawapigia wanakuja kukubeba. Wakifika pali fulani unapata mnaajakiwa, mnapigwa. Hatufurahi, tunaomba tu tafadhali wakubwa wa polisi, tafadhali hebu mchunguzeni hiki sanga. Hii ni dhuluma kubwa kabisa kwa wakaji wa annex.
Leo asubuhi karibu saa 2 hivi nikapigiwa na wakaji wa annex na my village elders, wakaniambia kuhusu incident ambayo imefanyika hapa, na hiyo ni uwaji. Watu walipokuwa wakipita wakasikia kwamba kuna mtu ameuawa. Huyu marehemu vile tumekuta amedungwa visu viwili, na tumeona vile damu imemwagika mpaka mahali tumepatea. Imedungwa visu viwili, na hatujui kwa sababu hatujafahamika kwamba bado DCI bado wanaendelea. DCI bado wanaendelea kuinvestigate kujua kwamba huyu mtu anaishi area hii ama anaishi.
Now, thousands of residents in the expansive South Ngariama land in Mwea constituency, Kirinyaga County, are set to be issued with title deeds as the Ministry of Lands kicks off the adjudication process. This follows a court order issued by Justice John Mutungi, sitting at Kerugoya Environment and Lands Court, directing the ministry to resolve the disputes that had rocked the area for over 3 decades.
Following a court order issued in Kerugoya Environment and Lands Court directing amicable solution to land disputes in the area for decades now, Ministry of Land has kickstarted the process of identifying owned land and disputed land in Mwea constituency.
Mnakuja kuangalia mipaka ama kugawa tena, kwa sababu tayari kila mtu hapa anajua shamba yake na kila mtu amejenga mahali alionyesha mipaka ya shamba yake. Naomba tu kutuelezee hapo, mnakuja kujua mipaka ama mnakuja kugawa? Kwa sababu kila mtu hapa hapo kwa shamba yake. Kama mimi nimejenga na nimekita misisi na ninaitwa siondoki. Sasa tuambie vizuri ndio tukukaribishe. Bure ukituambia unakuja kugawa, ndugu yangu, mkubwa wangu mheshimiwa, hatutakubali.
Ni kwamba tulikuwa hapa na sisi Gasove na wakachukua makaratasi yetu wakiwa na njio acres wakaenda nayo ili tupewe title deed. Sasa pia Gasove amesimama hapa na kusema wanakuja kurudia mashamba. Hii shamba yote ya South Ngariama iligawanywa, na sidhani kama kuna mtu atatoka mahali alipogawiwa asongee mtu ingine.
Kirinyaga County Commissioner Moses Ivuto and the County Executive Committee member for Lands, Reverend Samuel Kanjobe, during a public engagement forum in the land where the residents have been receiving sensitization. The Ministry of Lands official who will be involved in the adjudication process were in the area to familiarize with the residents and are expected to kickstart the process in readiness for issuance of the title deeds.
Tuji kupeana mashamba. Unasikiza vizuri? siji kupeana mashamba na hakuna shamba nimeweka kwa mfuko. Unalo mnaona? Na kuja kuandikisha mashamba. Tunaelewana hapo? Nakuja kufanya nini? Kukuandikia lile shamba lako ili nikupatie karatasi, shika, enda uchukue utaiki.
Na najua ya kwamba sio haki eti mtu analala ama amejenga mahali alafu kisha miaka inakuja ambiwe ya kwamba hufai kuwa hapa, ama watoto wake waambiwe haufai kuwa hapa. Na mimi niko hapa kutetea haki zenu, maanake ndio maana mlinichagua. Na nasema ya kwamba sikuchaguliwa ili watu wakiumizwa hapa mimi ni nyamaze.
Area administration has called on residents to support the initiative as they pledged to oversee the process in a fair and transparent manner.
Kila mtu anaonyesha kwake, na hiyo kijiji itachagua wale watu watafanya nini? Wanakuongoza. Kama una shamba pale, utachaguliwa na nani? Tumemaliza. Wakati kazi itaanza, kila mtu atasimama kwa shamba yake, na wale watu wako pale wataweza kuchagua wale watu wao watawaongoza ambao wako na mashamba wapi? Hapa. Tuko pamoja. Hiyo ndio nataka niwaeleze, na tuweke amani tafadhalini. Tuko pamoja. Unajua tunasema kwamba ni vizuri ukae na amani ukule mchanga kabla ukule wewe. Tuko pamoja. Si mwishowe kila mtu anakula na mchanga. Na itakuwa makosa kama tutaweza kuzozana kwa miaka na miaka nenda rudi, wengine wanaenda wanakuliwa na ule mchanga, wanaacha wengine wakipambana na waomba this time round tuweze kusikizana, tukue kitu moja, tuhakikishe kwamba tumekula mchanga kwanza kabla ule sisi. Tuko pamoja.
Area politicians present reminded residents of Mwea that the county government and national government had no other interest than to ensure that the land matter was permanently settled.
Kama kumekuwa na matatizo ya title deed, na mimi nasema ya kwamba watu wa South Ngariama ni watu ambao walichagua serikali ya William Samoei Ruto. Na mimi kama kiongozi hapa wa county sina interest yoyote kwa property hapa South Ngariama. Hakuna mtu wa familia yetu hata ana shamba hapa South Ngariama. Kwa hivyo mimi nataka haki patikane ili watu wa South Ngariama waweze kupata title deed zao.
For Ebru TV, Amode Francis.
Thank you, De Francis, for that report. Now, Kisumu County health workers have given a 30-day strike notice to the county government should they fail to address their grievances. Now, they want the county government to address issues on promotion of healthcare workers, staff shortages, irregular and discriminatory terms of employment, and issues of supply of pharmaceutical and non-pharmaceutical products to the facilities. Led by Kisumu County Branch KUSO Secretary Cyrus Odhiambo and Chairman Vincent Owa, they have threatened to down their tools after the period of the notice elapses should the county government fail to address their issues.
Number 4, unpaid 2021 January and February salaries to a section of healthcare workers. Following, for reasons only known by the executive of Kisumu County, in particular, the current CEC Health, formerly the Chief Officer of Health and the County Attorney, the county government of Kisumu have refused to pay salaries for the month of January and February salaries to a section of healthcare workers, despite the Labour office pronouncing itself on this matter and directing the county to pay these salaries by last year. We therefore demand that Kisumu County pay these salaries not later than the month of February this year, and we demand for the payment of our salaries for this January not later than Thursday this week. Convert all the current contracted staffs into permanent and pensionable, and with further employment should be done according to the SRC guidelines with all accrued gratuities. Failure to meet these demands, we are going to be left with no any other option but to seek redress using the law, and that include industrial actions as soon as possible and not later than in 1 month's time. So we are calling, in short, what you are saying, that if these things are not met, then we are going to go on a strike. There is no pharmaceuticals like gloves or even syringes to give injections. Healthcare workers have been turned into shop attendants whose only roles are to direct patients to go buy this and that and that. We are no longer providing services, but we have not tools for trade.
Go to Vihiga, our neighbor here. The people are being confirmed, but in Kisumu, we are being taken round the circles. In fact, people are being told that they signed this document that your facility in charge approves your name so that your contract can be renewed. You reapply for another 3 years. Remember, these people have worked for 3 years with low salary and under low morale. Now they are being told, instead of being confirmed as the governor promised, a document has been introduced to perpetuate corruption. And I say this very clearly because this document is meant to perpetuate corruption.
Now head to the northeastern region of the country, where elders in Fafi constituency of Bora East Sub-County in Garissa County have pledged to work and cooperate fully with the government in the war against terror, now in the area which has slowed down a lot of development projects.
Speaking after a special meeting with security officials, a section of political leaders, chiefs and elders, Garissa County Commissioner Boaz Cherutich said that citizens had promised to work closely with the government by sharing information on suspected Al-Shabaab terrorists.
Nataka kufukuzana na wale wakora ambao ni Al-Shabaab ambao wamejaribu kufuruka amani katika sehemu zetu, na kwa hivyo kuanzia leo tutakuwa na hawa wazee ambao watatoka nje ili kusunguka katika vijiji na kila nyumba ili kuhubiri hiyo maneno ya amani.
There has been suspicion that some members of the community know who the terrorists are, but are worried that they may be attacked when they share information with police.
Na tumesema kwamba kwa wale ambao tutapata habari ambao wanahusika kwamba wanahusika katika uhalifu, serikali itachukua hatua. Na tumeelewana hivyo.
Garissa Deputy Governor Abdi Dagani said that the recent terrorist attacks had created fear among the residents and that there was need for concerted efforts in dealing with the insurgents.
Kweli mashule zetu zimefungwa, watu wetu hawezi enda hospitali, barabara kupitika imekuwa ni ngumu, so watu wameona hapa hawana maisha kabisa. So sasa leo kwa kauli moja tumekubaliana, we compliment ile national government security wanafanya ili tupambane na hii janga la Al-Shabaab na tuwatoe Al-Shabaab katika kaunti yetu ya Garissa.
Fafi MP Sala Yakub on his part proposed to have a team of selected elders who will lead negotiations to have all the Al-Shabaab suspects leave the place.
Timu ya wazee waende wakae na wao waseme watoke kutoka ardhi yetu. La sivyo ni mapambano between them na wananchi na wakazi wa Fafi. Hata si serikali. So tunatoa dhidi kwa wale jamaa Al-Shabaab ya kwamba tunatuma wazee waende wawaongeleshe, wawapatie onyo, waambie watoke kutoka ardhi yetu. Haturuhusu kamwe hao jamaa waharibu maendeleo ya Fafi. Watutenganishe, watukataze miradi za maendeleo ziendelee hapo.
Rising terror attacks are reducing progress in the northern region, with terror alerts from the United Kingdom and United States embassies that terrorists are very likely to try and carry out attacks in Kenya.
And moving on, the residents of Ugenya in Siaya County are up in arms against their leaders for not pushing for the completion of a vital bridge across River Nzoia, resulting to the collapse of the local economy. According to the residents, of the closure of the old bridge, Nzoia Bridge was coupled with a lot of stalling to adjacent new bridges, causing a lot of business interruption.
Tumekuwa na shida hapa Nzoia kwa muda ya zaidi ya miaka mitatu. Tangu hii daraja ibomoke na waanze mpya, tumekuwa na shida mpaka Nzoia market imeanguka. Kwa sababu magari hazipiti, pikipiki zinakuwa na shida, wananchi wanakuwa na shida. Na tumetembea maofisi zote, tukitafuta usaidizi na hatujapata usaidizi.
Ni sasa daraja kubwa hii imekwama na hatujui ni shughuli gani yenye inaendelea kati ya serikali kuu na serikali ya kaunti. Shughuli gani yenye inaendelea na iko na mikakati gani kuzingatia kwamba hii daraja inasonga mbele. Kwa sasa sisi tumekwama na hakuna chenye tunaweza fanya.
Daraja haiwezi pitiki. Tunaomba serikali asaidie sisi. Watoto wanaweza anguka hata kwa maji. Tuko na shida sana, serikali konywa huru. Waligichandruok.
Tulikuwa tunadhani tumefaidika juu tulipata hii kiti ya gavana. Tangu aingie ofisi tumelia hii bridge inatusumbua. Hatujaona gavana yetu hapa, ni wa Ugenya. Saa hii askari ndio wameletewa, wamelinda daraja. Sijui hiyo inatusaidia kwa namna gani.
The last meeting I had on this matter was yesterday in the afternoon. As you are aware, when we are doing the tarmacking of the road, they are not factored in the cost of the bridge. This was done much later, and the contractor is ready with the bridge. It's already complete done. What is remaining is for the contractor to be paid money to bring the crane and put up the bridge. I've gone to their warehouse, I've seen they are ready to do it. What is lacking is the budget from the Ministry of Transport.
All right, it is 29 minutes past the hour in Istanbul, Turkey, and also right here in Nairobi, and a fine time for our first break right here on the Ebru Prime Time News. We take a short commercial break and we'll be back with more reports in a moment. Welcome back and thank you for keeping it Ebru TV. Now at this moment, we're about to launch into our discussion and talk on matters health. Now earlier today, we had an insight on the benefits of being onboarded on the National Health Insurance Fund cover. Now NHIF, the National Health Insurance Fund, intends to accommodate more vulnerable groups even as it seeks to implement universal health coverage. Now the head of the beneficiary management, Mr. Wambugu Kariuki, had a lot to reveal on the benefits of being a beneficiary of NHIF. Now, at this moment, I'm going to leave you with the discussion that we had earlier on as we finalize the Ebru Primetime News. Thank you so much for your valued company, and for this moment, enjoy the discussion and get all you can from that candid talk that was very, very knowledgeable from the man himself. Here we go.
Linda familia na marafiki dhidi ya magonjwa.
All right, thank you for keeping it Ebru TV. My name is Emmanuel Kutosi, and we are about to jet in our discussion concerning matters health. Health is an investment that is very key for you to be part of, and today we are joined by one from the National Health Insurance Fund who will be able to give us all of the benefits, all the good things that come out from you choosing to invest in your health. In studio today, we are joined by Mr. Wambugu Kariuki, the head of the Department of Beneficiaries Management at the NHIF, moving into looking at matters on the journey towards attaining universal health coverage within the country. Bwana Wambugu, welcome to Ebru TV.
Thank you, Bwana Kutosi.
Yes.
My name is Wambugu Kariuki. From NHIF, I'm the head beneficiary management. Beneficiary management is the department that is concerned with the enrollment of members, actually members and their dependents. We are also concerned with matters of enforcing compliance of the NHIF Act. And it is also the department under which the universal health coverage, implementation of the universal health coverage is being implemented, which is a task that NHIF has been assigned by the government. Yeah, so, and maybe just to correct you that NHIF is National Health Insurance Fund, not National Hospital Insurance Fund. We underwent an amendment last year in January, and the President assented to the new law on 10th of January, making, among the key areas that changed is changing NHIF from National Hospital Insurance Fund to National Health Insurance Fund. So we remain NHIF, but now H stands for health, not hospital.
I stand corrected. And I also have details, maybe you can clarify that it's also going to change by the 1st of July. We're going to move into a new name, the National Matters of Social Healthcare.
National Social Health, yeah. Again, with the new government, is that there is a proposal already that, again, we are going to be renamed to National Social Health Insurance Scheme. Though now that is something in progress. It's not something that has already been finalized on, and of course definitely once that is finalized, then every Kenyans will be informed. But right now we are still operating as the National Health Insurance Fund. But when now that time comes, when the process now of transitioning to what the current government has proposed, then Kenyans will be made aware of that. And definitely now we have to align ourselves with that.
But either way, you're getting the idea that you're moving into a way of ensuring health moves on a social play field. Rather, it's more of involving and not something that is isolated or targeted at a particular group, but something that wants to encompass all Kenyans within the whole journey, and particularly the universal health coverage journey. Now, I'd like to get your view from where you stand, because you are at a place where you're dealing with the beneficiaries, and that is the impact point of UHC. How has the journey been so far?
Okay, universal, or UHC, stands for Universal Health Coverage, and what it basically means is that every Kenyan, when a country gets into a point you can be able to say you're in a state of universal health coverage, or UHC, it means that every resident in that country, and actually the term is resident because it is everybody residing in that country, not only the citizens, including the foreigners who reside here, should be able to access healthcare services without incurring financial hardships. And those healthcare services should be of high quality. So it's about quality services and available healthcare services for everybody, such that you are not going to your pocket to pay for that health. Now, in terms of the journey, NHF as an institution, we are over. NHF was started in 1966, so we are almost 60 years now, about 57 years old, and current membership starts at approximately 15.8 million registered members. When now you include the dependent, the spouses, and the children, it comes to about 36 million Kenyans. Those are the ones who are registered with NHIF. But just to make it clear that as much as all those are registered, there's a big portion of them that are, there's a portion of them that are not currently actively contributing. So, because if you have to look at that coverage of that 6.6, you'd actually talk of about 75% coverage. But you know, the coverage is not there because there are a number of them who have enrolled with NHIF, but they are not actively contributing. And now that is where the idea of social health insurance comes. Why? Because now social health insurance means that no one is being left behind. Every person has been included in that social health insurance scheme. And what now the government is doing, and even what has been included in the Amendment Act, is a way now that ensure that everybody who is employed continue contributing through their deductions in their salary. Those ones in the informal sector, mechanisms are put in place again, how they can also be able to pay. Like the people in the boda Juakali, who are not on a monthly income, but they are making income by themselves. They should be able to conveniently pay or remit to NHIF. And then there's that category of membership, who are those ones we refer to as the poor and the vulnerable. Sometimes we refer to them as indigents. Those ones, again, the new law now makes it an obligation for the government to cater for them. The census of 2019 identified about 5.1 million households, and it is possible that number could have grown with the pandemic of COVID-19 pandemic. But whatever number it is, the law now makes it mandatory that every Kenyan will be a member of NHIF, either through your employment, a deduction, informal sector, you making the contributions from the income you're generating, or the poor and the vulnerable, the indigents, the government contributing for them. So those are the people now we have in the basket. Now everybody, the 12.1 million households in Kenya now, by the time we are talking of attaining UHC, should be in that basket. And that is now what the government is going towards, even as now it moves the idea of having NHIF being transformed to a national social health insurance scheme.
Bwana Kariuki,
yes,
you're talking about legislation.
Yes.
I believe it's the NHIF Act 2022.
Yes.
It's now mandatory for every Kenyan to be part of to be onboarded on NHIF.
Exactly.
So I'm coming back to the fact that when you look at laws in Kenya,
yes,
it's more of a whipping mechanism. It's like you're being channeled into a certain direction. But I'm looking at NHIF as something that is needs that the common mwananchi moves with the will and understands the importance of the whole setup.
Sure.
Now, how have you been able to use legislation to increase even subscription? Because we are calling out to people to register.
Yes.
What has been the impact of it being backed by a legislative muscle?
NHIF is, the good thing with NHIF is that it is matters health. And Kenyans appreciate that, and actually not only in Kenya, but healthcare services have become very costly. The law provides the framework, the legal framework, which now makes it now the law makes it an obligation for every Kenyan, or it is mandatory for every Kenyan to be enrolled. And of course, we know that those who are in employment are being deducted from their monthly income. Now, the category that is tricky to deal with is the category we call the informal sector. And that is why we are not talking of using a stick to make them pay, because that one many times does not bear fruit. What you need to do is, first of all, make them appreciate the benefits they are going to get from it. And our benefits are very good. A Kenyan with an NHIF cover will not face any financial hardships as they access their healthcare services, right from the primary healthcare all the way to even secondary and tertiary care. And the other thing is that, so the approach here is making it convenient. Among actually the thing that now currently NHIF is engaged in, is engaging with the informal sector groups. Because in the informal sector, actually, you find that's why we have associations and circles that are working very well. For example, you have already signed an MOU with KTDA, just to give an example, Kenya Tea Development Agency. That's why that all the farmers who are contributing through KTDA, now they just need to give the consent to their board, and then the deductions are done at source, such that the 6,000 that is paid for an informal sector person per year, that member, that farmer, a tea farmer does not have to be bothered. They give consent that once you receive, you are paying my bonus, or when you are paying my monthly, the amount they pay them monthly, just deduct the 500 or the 6,000 from my bonus, and I'm catered for. And we are engaging also with other circles like the Matatu circles, the Boda circles, and that way we will be able now to make it convenient for them, because they make money. For information, NHIF contribution is only 17 shillings per day. And that Boda guy, for example, the one in Nairobi, they make between 1,000 to 1,200 shillings per day. So if they were just to get 20 bob out of that money and put it aside, it is now an insurance for the whole family for the insurance. And Boda person in the village makes between 500 and 700 shillings. Again, they only need to take 20 bob. Even the Mama Boga, the profit they make maybe out of their selling the vegetables in the market every evening or through the day, maybe they make between 200 and 300 shillings per day. They only need to set aside 20 shillings per day, and that is sufficient to cater for the health insurance cover for the family. So the approach here is not using the sticks in terms of this is what the law says, but of course you tell them this is what the law says, but for you to be able to comply, this is how you comply. Tell your circle to pay for you, even because you find even those Mama Boga, they are having the table banking. They just need to have an arrangement with the official that out of what we are contributing every month, put aside this one, or every day, because I'm even contribute daily or weekly, put aside this one, and it goes toward the health insurance cover for my family. So the idea is making it convenient for them. Of course, first of all, make them appreciate the benefits, and then make it convenient for them, and that way everybody will have complied. If you use the stick, people will resist, and you don't achieve the objective for which you wanted it.
Indeed. And
Yes.
now, looking at the fact that you deal with the beneficiaries,
Yes.
that is where your scan is around.
Yes.
I'm going to ask you this. We have to look at the factors of value for money, because if Kenyans are to contribute these 17 shillings each and every day,
Yes.
it's a lot of money that needs to be accounted for in a proper way. Now I'm looking at the health facilities in the country. You've told me about tertiary, primary, and I'm
Yes.
also going to ask you to break that down, because to a common mind it may be hard to be able to differentiate what is the difference between these or the other.
Yes.
How do you ensure that there is a quality that is standard and optimum for the common mwananchi?
Thank you. One thing I want to assure Kenyans is that in NHIF we have a very clear and, I would say, elaborate process of bringing facilities on board. And actually that process does not start with NHIF. It starts with the Ministry of Health, because remember the responsibilities of regulation of matters health is the Ministry of Health. So NHIF actually comes to the tail end when facilities have already been qualified by the Ministry of Health. Because the Ministry of Health has department like what we call the Kenya Health Professionals Oversight Authority. It's called KHPOA in short. We also have the Kenya Medical Practitioners and Dentists Council. Those bodies are involved in the processes of licensing and ensuring that the facilities that are offering healthcare services in Kenya, that is government, private, and faith-based, they meet a given level of quality that is defined. Now, once a facility has been licensed and registered by the Kenya Medical Practitioners and Dentists Council, the Kenya Health Professionals Oversight Authority has been able to again confirm the healthcare professionals that are giving services in those facilities meet the criteria that have been set. And NHIF now gets that list, gazetted list, and now again confirm that which services are these facilities able to offer. Once we confirm the services they are able to offer, then we empanel them. And when we put them in our panel, we actually sign a contract with them. The contract has very clear obligations even in terms of quality. And even to make it better is that NHIF has a full-fledged quality assurance and standards department. And we have officers even at the grassroots level. And these officers are trained medics who now engage with those facilities continually. They actually engage with what we call the quality improvement teams in the healthcare providers to ensure that the level of quality that is being given to our members is that level that has been determined. And if we find a facility has a gap, we will take action at on our side, but we'll even escalate it, for example, to the Kenya Medical Practitioners and Dentists Council, so that they can also be able to enforce where we feel this is now an issue that needs to be addressed at that level. What we need to address at our level, we can terminate a contract with that facility, or we can put any other sanctions. So in terms of assuring Kenyans, because currently we have 8,547 facilities in our panel. Of course, the majority of them are government, 66%, and that is the beauty of it.
So the 8,000 is both public and private?
Yes, it's good because we have government are approximately 5,600, private are approximately 2,600, and the rest are faith-based, about 300 and something. So those now comprise the whole panel of hospitals that our members can access benefits from. And any of those facilities, and what I was saying is that the beauty is that most of them being government, and this is a government agenda, then the government has a commitment to ensure that those services are meeting the quality services that Kenyans want. For private and again for faith-based, again we are working with them very closely, and they have associations again they have formed. We meet with those organizations on quarterly basis to tell them, and we point out to them, we tell them there is a gap here, there is a gap here, there is a gap here, and we even mention to them specific facilities. There is this facility in your association that we are having a challenge with, so them they take it up. And even if they don't take it up as an association, as an NHIF, we are going to take it up and ensure that facility is able to do the right thing. So Kenyans can be assured that as they go to receive care in a particular facility that is empaneled with NHIF, the quality is there. And we have actually suspended or even terminated contracts with those facilities that didn't meet the threshold that we have set. Yes.
And you've told me that NHIF comes at the tail end of this whole process.
Yes.
In real sense, it's that NHIF is the impact that the common mwananchi will feel.
Sure.
We are talking on matters of the benefits of the beneficiaries.
Yes.
What benefits are these that are being offered to Kenyans?
Good. That is one of the best questions I like answering. Because Kenyans need to know, for a long time, and as I mentioned, we used to be called National Hospital Insurance Fund. And why we were called being National Hospital Insurance Fund, and I believe maybe that is why at the point when NHIF was formed in 1965, through the session on paper number 10 of 1965, and then NHIF was born in 1966 as a department in the Ministry of Health. It was a National Hospital Insurance Fund because by then it was catering for hospital expenses only. And actually, for a long time, Kenyans would say NHIF hulipa tu kitanda. That was the talk. However, in the year 2050, of course, we became a parastatal in the year 1998, and still we continue to agree to just covering inpatient care. That is why Kenyans would say we tunalipa kitanda, because you could only be catered for if you went for an admission. But in 2015, we enhanced our benefit package. That is the year when the monthly contributions were enhanced, and also the benefits were expanded. From just that one benefit of inpatient care, ama kulipa kitanda as Kenyans would call it, now we are paying 10 benefits, and I'm going to just mention them very quickly. Benefit number one is outpatient care. Outpatient care had not been offered all those years from the time NHIF was formed in 1966. But from 2015, Kenyans started enjoying outpatient care. What is required for the Kenyans is that you need to identify the hospital where you need to be going for your outpatient care, and then you tell NHIF, this is the hospital where I want to be going for my outpatient care. Number two is inpatient care.
And before we go to inpatient,
yes,
how about we break down what we mean by outpatient care?
Now, outpatient care would say it covers what we call the basic or primary healthcare services. Any treatment that does not require you to be admitted. You have a cold, you have some stomach infections, you have some upper respiratory tract infection, any treatment that you go, the doctor is able to see you, prescribe some medication or some tests are done, and does not require you to be admitted for care. So it is, you go, you are treated, you go back home, because you can still be able to receive and administer medications to yourself at home.
And NHIF covers the cost.
NHIF covers the cost. What is required for you is that you need to have selected a hospital where you need to be accessing those services, because NHIF actually pays that facility to ensure that it is able to give the services that you have agreed with the facility to offer you. Primary health care. Then we go to the inpatient care. Inpatient care now is now any treatment that requires you to be admitted in a hospital because maybe it requires more closer attention by the doctor. So you are going to be admitted for a day, 2 or whatever period as the doctor determines depending on the ailment that you are suffering from. Again, NHIF will be able to cater for your bills. And maybe before, even as I go to that, as I was mentioning about the healthcare providers, the 8,547. Those facilities, again, we have contracted into them into 2 categories of contracts. It is very important I clarify that as I mentioned the benefits. Now, one contract, we call it comprehensive contract. What that means is that any member of NHIF or any beneficiary of NHIF going to that hospital will be able to receive care and they will not have to pay from their pocket more often than not, unless somebody has exhausted their limits. We actually say it is a walk-in, walk-out. You go, is a mother going to deliver, whether it is CS or normal delivery, you go deliver, go back home. You have been admitted with typhoid, with malaria, with whatever ailment you are suffering from. You'll be admitted, NHIF you'll be able to cater for all the tests, all the lab tests, all the examinations that need to be done, the consultation fee by the doctor, the nursing care, the bed, and everything you'll be catered for in a comprehensive care facility. We have what we call non-comprehensive contracts. Now, non-comprehensive contracts are the fewest because they are only about slightly less than 700 facilities in the country out of the 8,000. Now, those facilities now we sign non-comprehensive contract. What it means is that if you go to such a hospital and you're admitted, and the sheriff will only pay for you a portion of a bill, and then there's another bill that you need to cater for with your other insurance cover. Because the assumption is that by the time you're going to those high, because they are mostly high cost, by the time you're going to that high cost, more often than not, it's expected that you have another insurance cover over and above NHIF, so that NHIF will pay its portion, and the other insurance will come and pay their portion. So that is now how inpatient works. If you go to a comprehensive contract facility, the entire bill is covered by NHIF. If you go to an uncomprehensive, NHIF covers a portion, then the other insurance or USF will cover the rest. Benefit number 3 is maternity. I think I've already explained. We cover both normal delivery and cesarean section delivery. Benefit number 4 is radiology. We cover advanced radiological procedures. The radiological procedures that are likely to need are like X-ray, ultrasound, CT scan, and MRI. Now, X-ray and ultrasound are covered at both inpatient and outpatient. Those are basic radiological procedures. So if you need an X-ray or an ultrasound, it is going to be catered for either within your inpatient or your outpatient, depending on whether you are being treated as an outpatient. But now when it comes to the advanced ones, which are expensive, the MRI and CT scans, we actually offer them as standalone benefits because they're actually not even available in many hospitals. So if, for example, you go into a facility like Bagathi, just to give an example, and then the doctor prescribes an MRI and they don't have an MRI there, you are going to go to a hospital where they have an MRI with that prescription. The hospital is going to make a request to NHIF, and NHIF is going to pay for you for that MRI without you going to your pocket. The same case with CT scan. Benefit number 5, I believe we have the surgical package. The surgical package is another very popular package. And why it's popular is that for a long time, Kenyans have been suffering for intervention when they need surgical interventions for their healing. But because we know surgical procedures are very expensive in this country, Kenyans would die with their sickness at home. But when we introduce the surgical procedures, it means a Kenyan requiring some minor surgeries, major surgeries, and even specialized surgeries. Specialized surgery, we are talking of things like total hip replacement, total knee replacement, craniotomies when you're operating things to do with the head and that. Now they are covered under NHIF. And provided you have an NHIF cover and you are going to the hospitals we are calling comprehensive, which are the majority in the country, the faith-based, the government facilities like Kenyatta and others, MTRH, KU Hospital, you will be able to be covered for that craniotomy, total hip replacement without paying a cent from your pocket under the specialized benefit, under the specialized surgery. If it is a major surgery like abdominal, what we call total abdominal hysterectomies and others, again you'll be catered for still fully by NHIF if you go to a comprehensive care facility. So a very popular package because now many Kenyans have been able to access surgical procedure that they could previously not afford. And by the way, even if you needed that procedure out of the country, for example, maybe it's a procedure that cannot be done locally, you are also covered for that procedure out of the country and you'll be able to pay for you. If that is the procedure you pay for 100,000 Kenya shillings in Kenya, we'll actually be able to pay for you the same amount in a hospital in India, Turkey, or wherever. Benefit number 6 is oncology care. Another benefit that Kenyans have utilized. Cancer care. Cancer treatment is very expensive.
Very, very expensive
very
indeed.
Expensive. Actually, when a member of a family is diagnosed with cancer, that family know we are done. We are going to sell our cows, we sell our property, we sell our land, we do fundraising, and finally the person dies. and the family is completely bankrupt. And almost every you can be able to give witness. Now, Kenyans can be able to access 4 benefits, actually 5 within the oncology care. You are able to access basic chemotherapy, you are able to access complex chemotherapy, and by the basic chemotherapy, you pay for you up to 25,000 shillings per session. Complex chemotherapy, you pay for you up to 100,000 Kenya shillings per session. Then we have what we call radiotherapy. Again, radiotherapy will cover you approximately 3,600 shillings per session. And there are several sessions. Then you are covered also for brachytherapy, mostly used for treatment, I think, for cervical cancer. Again, you are covered for brachytherapy. And you're also covered for PET scan. PET scan is, an radiological procedure that's specific for cancer to determine to what extent cancer has spread in your body. Again, it's covered within the oncology package. So what we are saying, a Kenyan who unfortunately has been diagnosed with cancer, they don't have to do fundraisings. They don't have to sell their property. They are covered fully by NHIF. Even that Kenyan who is contributing only 6,000 shillings per year, they are covered for those procedures. And I'm mentioning you can be covered up to 100,000 shillings per session. Another benefit is renal dialysis. Kenyans who are suffering renal failure. Unfortunately, Kenya is a country where we are having so many cases of non-communicable diseases, the chronic illnesses, hypertension, diabetes, that are leading to renal failure. Now, with renal failure, it means that your kidneys can no longer function, and you need to be assisted artificially to go through dialysis as the procedure. So dialysis is covered for 2 sessions per week, and each session we cover you for 9,500 Kenya shillings. If you multiply that per year, we are actually covering that Kenya for about 988,000 Kenya. That's about $1 million. A Kenyan who has given you 6,000 is able to enjoy a benefit of $1 million within 1 year. And remember, this person could be accessing dialysis, is being admitted for other procedures. So within a year, maybe this person has access benefits worth about 2 million Kenya shillings. So when you are talking of value for money, as you mentioned somewhere, Kenyans are really getting value. Actually, sometimes when we make such presentations, even too, when countries come to benchmark with us, they ask us, what magic are you doing? With 6,000 Kenya shillings, you can be able to offer all those benefits. And we tell them, yes, it is efficiency in terms of management of the resources that we have. And that is where we have gone even beyond and negotiated with facilitators we are calling comprehensive contracts, so that we assure that Kenyans are not being required to co-pay when they go to receive care in the healthcare providers. Another benefit that we offer is what we call mental and behavioral health package. This is Kenyans who have mental issues and they need to go to a mental hospital or a psychiatric care. They are covered by NHIF, and even those Kenyans who unfortunately could be abusing drugs and they need rehabilitation. They are also covered for drug and substance abuse rehabilitation. We have rehabilitation centers we have empaneled in the country where a Kenyan can go and they are paid for up to 60,000 Kenya shillings for them to go through the rehabilitation process. Another benefit, number 9, is the road ambulance services. Kenyans need to know that if in a situation of emergency and you are an NHIF member, you are at home and an accident has happened, or even on the road, or even you're in a hospital and you need to be transferred because adequate care is not available, the doctor has prescribed, you need to be transferred, you don't have to pay from your pocket. There's an ambulance service you can call. We have contracted an ambulance healthcare provider which has a network across the country under the Red Cross, and you can simply call, an ambulance comes and takes you where care is available, and you're not paying a dime from your pocket. And lastly, we have the overseas care, as I had mentioned earlier. If treatment is not available locally, you can actually access it out of the country, and NHIF will be able to pay for you to the same extent it could have paid for you locally, to be able to pay for you when you go for treatment abroad. So Kenyans, you are covered by NHIF. If you have not enrolled, you need to enroll, because there is actually a lot of financial burden NHIF is going to take away from you as far as your healthcare is concerned. And as we talk of UAC, and that's why we're very happy even to see successful governments pushing that agenda. It is very important that Kenya gets to a state of UAC where every Kenyan can go to also access these benefits without facing any financial hardships.
Linda familia na marafiki dhidi ya magonjwa.
There's something you've touched on that has actually caught my attention concerning the ambulance services. It is something that commonly has been assumed to be a privilege of a certain class of Kenyans.
Yes.
So are you saying that a common mwananchi with an emergency at home can be able to link up and get the services to be transported to hospital?
Exactly. That's what we are saying. There is a road ambulance service that is available for every Kenyan who is a member. Of course, that is the point, that you must be a member of NHIF.
And an active member.
And of course, an active member, because actually when you call them, the numbers you call is that the first thing they'll check, are you an NHIF member? Are you active? Then they are going to release an ambulance to come and pick you.
And is it like one number or is it several?
Yeah, and they have a toll free, they have several numbers I'm going to share with them before we finish. They have numbers you can be able to call them. There's a number you simply dial, they call, they ask you a few questions to confirm you're a member, they'll ask you for your ID. If it is somebody, a relative who is calling you on your behalf, they just need to know your ID because they must be able to confirm, and you are picked. And that is the fact. Kenyans need to know that you can call an ambulance. It's no longer a preserve of a certain class of the people. It is for every Kenyan who has enrolled with NHIF. And there is no reason why you should not enroll with NHIF, because you only need to be setting aside 70 shillings per day, round it off to 20 shillings per day for your family cover. And you can actually be able to access those ambulance services. You are a young person, your wife is delivering and she's caught up in the house. Before she goes to the hospital, she needs to be rushed to the hospital to deliver. You simply dial an ambulance, you'll be at your door to pick you and take you to hospital.
Now, something I'm getting out of this, you'll forgive my idea of actually having a money-centered approach. I'm seeing value for money in the fact of subscribing to NHIF. Seeing that for 6,000, you can be able to get treatment that is worth almost more than 1,000 times that amount. And looking at this, it's like you're saving the government a lot of money through this process, which means there is an economic aspect of like benefiting the nation on an economic aspect.
Exactly.
Now, when the strategies are being laid out for health facilities, that is public health facilities, because they're the ones that the government has a straight approach towards. NHIF may be at the tail end of the whole processes, but is a key stakeholder. How are you speaking into the boosting of facilities, that is public facilities, so that there is not that much disparity that you can say that you go to a private hospital or because it is expensive or has more facilities or the like? How are you speaking into this and seeing a change within public facilities and seeing that they upgrade to a level when they can actually be able to compete in a very fair manner with the private counterparts? How are you seeing, or rather speaking into this and ensuring that public facilities are also becoming places which are preferable for Kenyans, because the matters of health is a subject of trust? How are you doing this?
Thank you. That's a very important question. And actually, that is an area that we need to address. But I am really happy. And as NHIF, and we are happy. Because we have seen a lot of effort that are being done by the national government and also by the county government. Because remember, healthcare is devolved in this country. We have had a lot of engagement with the Council of Governors, which now the umbrella body for the county governments, the leadership of the county governments. We also have the Ministry of Health actually on it. Because one thing that the government is making every effort is to ensure that facilities that patients need in the hospitals are available. Just last week, actually, we had a workshop where the Ministry of Health had organized. And the discussion was on provision of ensuring there is adequate supply of what we call health products and technologies, the HPTs in the healthcare providers, to ensure that the drugs, that is the pharmaceuticals and the non-pharmaceuticals, are available. Because one of the challenges that Kenyans will tell you, I'll go to a government facility, yes, I'm going to find a good doctor, prescription is done, but when I go to the pharmacy, the drug is not available. The government is already on it. That discussion that we had last week was about that. How do we ensure that there is adequate supply of health products and technologies in the government facilities, that there is no time a Kenyan will go and they'll be going to be referred out there maybe to do an X-ray or to do a lab test or even to pick drugs. So that one is already being done. And just to emphasize is that NHIF, we are actually under the supervision, we are actually a state corporation under the Ministry of Health. So we work very together. Actually, most of the strategy that the Ministry of Health is putting, of course being now the government ministry, will always bring NHIF on board to also give our contributions to that process. And that is why even a workshop like that one, NHIF had to be a part, so that we can also be able to put across and say, among the challenges that we are facing that could be driving patients in private facilities should be treated in government facilities, could be lack of drugs, another thing. So we are actually on the table, we are discussing it, and we know with the commitment we have seen with the government, we'll be able to get to a point where the facilities that are offering the best care in this country are government facilities. It is already happening in some countries, and so it is actually going to happen in Kenya. And we have already seen that commitment with our current government, and we know that was going to that will come to realization. Yes.
And Bwana Kariuki, when you're talking about beneficiaries,
yes,
perhaps you can give us a rough overview, or rather an average,
yes,
between last year and to this point. About how many beneficiaries have been able to benefit from the activities of NHIF?
In terms of maybe to mention it in terms of the figures, the monies, even without mentioning the specific, the number of people who have benefited is that out of the contribution that we received from our members last year, 90% of that, when you're talking of 90%, you're talking of over and above 70 billion Kenya shillings went to benefits to members. So we are saying that NHIF was able to pay bills for Kenyans amounting to over 70 billion Kenya shillings in the immediate last financial year. So that is the impact that we are making in Kenyans' life in this country. So many Kenyans have been able to benefit through the NHIF cover. And many Kenyans have been able to be saved from financial hardships by being members of NHIF.
And when you say around 90%,
yes,
is that a good thing or a bad thing when we have spent about 90% of their funds?
That is actually better than the prescribed rate, because for a social health insurance, and especially because health insurance is a service, is a service-oriented sector, such that in terms of admin expenses is likely to have a lot of admin expenses, and because of that reason, the recommended what we call loss ratio, or the amount that should go to the member is 85%. So when you are performing at 90%, you have actually performed better than the recommended, the prescribed rate. So you're actually doing better than what would be expected. But we have not stopped there. Just to mention is that in 2018, when the idea, when the piloting of VSC was being done, in 2018-19, there was a panel of experts that was formed called the Health Reforms Expert Panel, HEFREP. You have heard of HEFREP. Now HEFREP, one among the recommendations that they did is that NHIF should be able to spend not more than, NHIF should work towards spending not more than 5% of what they collect for the admin expenses. So that is the journey we are in. In 2016-2017 financial year, we were actually at over 22% at what we are spending on our admin. Right now, in the immediate last financial year I've just mentioned, we only spent 10%. And it's a journey we are in to actually get to that point where out of every 100 shillings we collect, 95 shillings goes to the member, because that is how it should be. I wish it was actually possible for 100% to go to the member. It's only that salaries have to be paid, another admin expenses that have to go with offering those services are concerned. So definitely there will be an element of admin. But the move is towards making it as efficient as possible so that the maximum of the contributions we collect are going as benefits to the members. And we're already there. And we can say that Kenyans can be sure that whatever resources they are giving to us, they are going to the right thing. And when we are talking of 70 billion going to their benefits, it's not just a figure. It's actually at least you can be able to show that these are the Kenyans who have actually benefited. They have received maternity care, surgical services, dialysis, oncology care, cancer treatment, both here and even out of the country. Kenyans can be able to appreciate that.
Bwana Kariuki,
yes,
in your estimates, or rather because you are there on the ground,
yes,
you are seeing the impact of the beneficiaries,
yes,
how the whole process is playing about,
yes,
the journey to UHC,
yes,
totally, in your estimate, how long will it take us to be at 100%?
You know, this is a journey that can take a very short time, where we have the kind of commitment, both political commitment and because when you look at our country, the executive is on it, the legislature is on it, everybody is on it. And we have capable institutions to be able to deliver that when you're talking of institutions like NHIF, because that is the advantage a country like Kenya has. When other countries are coming to benchmark from us, one of the things they say, the beautiful thing you have is that you already have a good and a stable health insurance organization that is NHIF. When other countries are thinking of UHC, they have to start from very far if they don't have such an institution. So for Kenya, other countries, why I was going there is that other countries, like when we have studied countries like Thailand, which are already in a state of UHC, they have taken a journey of almost 20 years because we have been able to really have some exchange programs with them. Kenyans, even according to HEFREP, the recommendation was that within 15 years, we should be able to be in the state of UAC. But from the progress we have made this far, we should be able to achieve UAC even in the next 5 years if we move with the current trend. Because what is required for us to be in a state of UAC? Because a state of UAC, as I mentioned, is that a Kenyan should be able to access healthcare services they need, and those services are of good quality without suffering financial hardships.
Yeah.
So how will you ensure that Kenyans don't suffer financial hardship? I've already said because we are looking at it in those 3 sectors. The formal sector, it is the responsibility of NHM to ensure that everybody who is employed, yourself, myself, and every Kenyan who is in informal employment, they are paying. And it is our mandate to actually now enforce that compliance by making every employer who has employed somebody is making sure that they are deducting and remitting to NHIF. Number 2 is the informal sector. I've just said the informal sector is the tricky sector, but we have just said that one of them we are doing is that we are making it convenient for them. That informal sector person is a SACCO member. Even if they are not a SACCO member, they are accessing government services somewhere. So make it convenient for that border guy as they go to renew their license, for example. You make it, there is a way to remind them. You tell them, as you are renewing your license, you also need to be catering some amount of money to go towards your health insurance. And among the things we are doing is that even now engagement with the telcos. Kenyans interact a lot through M-Pesa. They're always making transactions. That border guy is receiving, that Castas guy is receiving the money through M-Pesa. So through those channels, those digital channels, because remember we are a digital country. Kenya is rated as a country that has embraced digital technology highest, actually I think it could be, actually maybe if not the highest, among the highest in Africa and even in the world. So with that adoption of digital or acceptance of the digital way of doing things, it becomes very easy now to make it very easy for the informal sector to pay. And of course the other is that we see it through the SACCOs. The majority of the Kenyans in the informal sector, by the way, talk to even the border guy who is, are you in a SACCO? Yes. Even the mamas in the market, they have SACCOs. So let them pay through those SACCOs very conveniently. The third category now that you make it very easy for us to achieve UAC very fast are the indigents. The law has made it now an obligation for the government to pay, and to make it to show you that the government is committed. They have already paid as we speak. The government is sponsoring 3 categories of indigents, the poor and the vulnerable. There is what we call the health insurance subsidy program for the orphaned and the vulnerable children. The government is already paying for over 250,000 households. Then there's also another category called the health insurance subsidy program for the elderly and the severely disabled persons. The very elderly people who cannot earn a living, the severely disabled, the government is paying for about 58,000 households under that. Full sponsorship at the NHF. And the third category are the indigents who are identified under the UAC program now. The government is already paying for 1 million households. And you're talking of a household, when you're talking of 1 million, if you multiply by 4, because the Kenyan population from the census done in 2019 shows that the house size is on average 3.9, call it 4. So when you're talking of, now when you add up the 2 HIPs and now the UAC, it is coming to approximately 1.3 million households. If you multiply by 4, you can see the number for yourself. Now to make another big stride is that even as we speak, the county government, under the instructions of the Ministry of Health, is that they're in the process of identifying another 500,000 households to add now into the 1.3, so that now we can progress towards now covering the entire 5.1 million households. So what we are saying with that kind of commitment, because the government can even now allocate in the next financial year, I'm not saying that is what you do, but they can decide that out of the 5.1 million households we want to cover, we just need to allocate that 1 billion Kenya shillings, and all that category of Kenyans are going to be covered. So what we are saying is that within even 3 years, with that kind of commitment, the country can be in a state where every Kenyan is covered under the social health insurance scheme. And so whenever they are going to the hospital, they are using an insurance, they are not paying from your pocket, so they'll never suffer financial hardships. And there you have UAC. So it can actually be achieved within a very short time. Yes.
And we are talking about the government and its move to ensure UHC is realized.
Yes.
Among the things that the government of the day has been pushing for is preventive healthcare. How is NHIF building into that? Because it is something that the government is also championing for. How are you moving into that? Because we find a lot of illnesses that could be managed if they were early detected, including cancer.
Yes.
How are you feeding into that?
Thank you. That's a good question, because as a country, definitely, we have to go that direction. When you see even, when you see like the rise in cancer, when you see the rise in non-communicable diseases, it will tell you that something definitely needs to be done to actually address that at the point of prevention. So in terms of preventive and promotive care, I know that is a role that may be, because that is not, because NHIF is, you see, is being implemented through an output financing model. Output financing model means is that we are paying for output. Our beneficiary of NHIF has to go to a hospital, receive care, then we pay for the care given. Output, we are paying for output. Preventive and promotive care is mostly catered for through an input financing model. And that is why it is mostly done through the government, the Ministry of Health, Department of Public Health and others, and also at the county government. NHIF, we play still a role, because when it comes to things like immunizations and such, we participate, which is also preventive. So, though we are not playing a key role there in terms of reimbursing for that care, but as we now work together, now we're able to see now how do we come in, so that whatever now can be catered for through. However, even when you're talking of primary health care under the capitation outpatient care, among the things that the healthcare providers that we are paying capitation are supposed to be doing is continuous health education, which is plays a role in preventive and promotive care. Because out of what we pay them for the capitation for the outpatient, they are supposed to ensure that as they are meeting with the patients, and they are meeting with the public, they are also carrying out continuous health education. So that way, we are playing a role. We are not reimbursing it as a reimbursable benefit, but we are playing a role, though no major, but the major role is being played at the county government level, and of course at the national government level by the Ministry of Health, by the relevant department that are dealing with preventive and promotive health care. But we know, for a country to be in a state of UEC, that had to be strengthened, and I know it is already happening in quite a big way, and then even the curative care also has to be strengthened. That we will be able to get to a point you can be able to be in a state of UEC. And the beauty is that if you're able to do the preventive health care very thoroughly and well, then you find that you actually reduce the burden in the curative care. And that is where we want to be, so that we can save more and maybe cover more in terms of benefits that we are covering under the curative care part of it.
Bwana Karugi, early this month, we began the academic calendar. Students went to school, pupils, the young graders, new ones. Along the education sector, a lot has been happening. I'm going to ask you about cover. I had, maybe you can be able to give me more about it. The Edu Afya. Can you tell us more about it?
Yeah, Edu Afya is a good cover. Thank you for that question. Edu Afya is a very good cover for high school, public, secondary school students. This is a cover that was started by the government in the year 2018. And remember the government has, the government came up with the agenda, actually right from about 20 years ago, during President Kibaki's time, 100% transition, every child to go to school. Now when it comes again now to the secondary school, where again students have to go to boarding schools and such, the government appreciated that there are instances where again these students' education is going to be interrupted. Remember those, they are in their teenage, because when children are going through their adolescence, even in terms of health challenges, they face a lot of health challenges. Those transitions, puberty and all that. So a government appreciated that by coming up with a cover to take care of the teenagers at that level in high school, and came up with what we call the Edu Afya, a cover which is a public secondary schools cover. So what the government does is that it pays premium for all public secondary students cover, and those students are able to enjoy comprehensive benefits, even beyond what I just mentioned, because then they're able even to enjoy air rescue. If a child is in Madeira and they have been diagnosed with a procedure that cannot be treated in Madeira or Lodwar, we have already contracted an air rescue who can be able to pick up that child there and bring them to Nairobi or wherever to receive adequate care. And they can also be treated out of the country. They can also be treated for any ailment that they suffer without having to pay from their pocket. So it's a comprehensive cover for public secondary school students that the government came up with to ensure that those students are able to stay in school, they study without having to be unatumwa mzazi uende utibiwe alafu urudi. So mtoto atatibiwa na arudi shule aendelee na masomo.
So the cover is regardless of whether the parent is an active member or not?
Yeah, the cover is for to ensure that those students can be able to receive care while in school without having to interrupt their studies at all. Yes. So whether the parent is an active member or not, this one ensures that that student is actually receiving care and actually able to continue their studies without any interruption. Because of course if they are going to use their parents, it means atatumwa nyumbani, eda kwa mzazi utibiwa kupeleka hospitali, halafu rudi. Now they're interrupting their school time. Let that student be taken to the school, to the hospital by the school, given drugs, medication, and then return back to school to continue the education. Thereby, you are going to ensure that the students remain in school and there is no interruption of studies. And that is going to ensure the government achieves its target of 100% transition from primary to secondary school, and they actually finish secondary school to the other levels. Yes.
A very proper initiative, and looking even at the way it was thought out, it's a very creative concept and something that is very workable, even facilitating other sectors within the country.
Exactly.
Are there other initiatives that you're coming up with, perhaps, that you can be able to share with us that are of such a nature?
Of course, we have just mentioned that we have, like, of course, any such is now when we are talking of indigents cover, where now those people who cannot be able to cater for themselves, the government has been able to cater for them. Besides that, of course, we have covers for persons who have retired. Currently, NHIF is running covers for retired senior citizens. Because again, senior citizens are people who face challenge because you have retired from employment, where you are being paid for through a monthly deduction. You are enjoying a very good cover as a government employee maybe, but now you are out there and you want to and remember, even the elderly are very prone to ailments, sicknesses, infections. So you need to ensure that this person can continue enjoying adequate healthcare services for them to remain healthy. So because of that reason, even in our current act, there is a provision where now NHIF can actually engage with the post-retirement medical funds, where now we develop a cover for them such that when you retire, you can continue enjoying a cover upon retirement without having to face any challenges even in terms of contributions. But even before we get even now to the implementation of a post-retirement medical fund cover, we are already having covers with, negotiating covers with certain retirement schemes. And we have been able to bring on board a number of them, even an umbrella one we called CARO, Kenya Association of Retired Officers, so that upon retirement you enroll and you can continue accessing care. So that those are among them. We have the retired officers, we have those ones for the indigents. So there is a provision that no Kenyan can be left behind in terms of enrolling for health insurance in Kenya. Yeah.
Now, we're going to finalize it, but I'm going to ask you to talk to Kenyans and tell them why it is important. Because you are on the parts where the benefits are. You're able to actually give this information with authority. You know everything concerning the benefits. You've even seen the whole play out with people actually being able to be helped and be able to be assisted just by taking time to invest in their healthcare. Speak to Kenyans and tell them why they should be part of NHIF as we go towards the journey of universal health coverage.
Thank you. Thank you so much, even for having this opportunity actually to be able to talk to the Kenyans. Kenyans, as a nation, we are on the journey to universal health coverage. We have started, that journey has started at your net. And every Kenyan will be able to access healthcare services of high quality without incurring financial hardships if they are going to enroll with NHIF, which is the organization that have been tasked by the government to be able to drive the USC agenda. So I'm telling every Kenyan, if you are there and you are an employee, and you know your employer is not making any deductions from your income at the end of the month, just go and talk to them and tell them that you do want to make your contributions to NHIF, because this is purely a deduction from your salary. The employer is actually not making any additional contributions. So you need to go to your employer, tell them, I would want to be making you to be deducting my NHIF contribution. Even in the informal sector, you are border person, in the Juakali, you are Mama Boga, you actually need to be setting aside only 17 shillings per day. Call it 20 shillings. Unachukua hiyo bao every day and you put it somewhere. So that at the end of the month, actually, if you put bao, you'll actually have 600 shillings. You'll be able to pay that 500 shillings to NHIF, and it is going to ensure. And remember, this is a family insurance. Once you pay that 500 of that 24 per day, it is catering for you, your wife or husband, and all your children, regardless of the number of the children you have. So you need to go to our website, where you can actually be able to register online. You don't need to go to any NHIF office to register online. Go to our website, www.nhif.or.ke. If you go to Google and you just search NHIF, you'll be able to find our website. Log in there and you'll be able to see an online registration link. Click there. What you need as you go there is that you need to have, you need to have a copy of your ID, which you could have scanned. You need to have details of your spouse's ID. You need to have of course, your names and that information, so that when you go there, and you go through that process, you are going to be issued with an NHIF number, and from there you can start making your contribution. If you are not going to the website, you can actually use your phone. You can simply dial the USSD code *155#, and it's going to take you through some prompts, and you'll actually be able to enroll with the NHIF. You can also go, if you have a smartphone, you can download the My NHIF app, and you'll actually be able to go through the process of registration, and you become a member of NHIF. To pay is very convenient, because again, you don't need to visit any NHIF office to pay. You pay through M-Pesa. Paying through M-Pesa, you simply go to Lipa na M-Pesa, pay bill. Our pay bill number or business number is 200222. I repeat again, 200-222. 200222. When it asks you for the account number, you put your ID number. Now, for you to do that, of course, first of all, you need to have registered. You already have an NHIF number, but when you are paying, you use your national ID as the account number. Even if you are paying for somebody, because you could be paying for your parents, when it asks you for an account number, you put your parents' ID number. And that is also very important to emphasize. You could be there, you are working, you are being deducted, but you have your parents, you have your relatives who are always reaching out to you when you have they have a bill to pay, and they're telling you. The best thing to do is that get a cover for them, be paying for them the 6,000 shillings per year, and you ensure that whenever they go to the hospital, they simply present themselves there, and you don't have to be called to pay any money. We already transitioned actually from using the physical cards. Currently, we are using biometric to make it even more convenient. Again, if you have not yet given your biometrics, now that one you have to visit the nearest NHIF office so that your fingerprints can be taken, so that wherever you are, or wherever your child is, or wherever your spouse is, they don't have to call you to tell you, give me the card so that I can go to the hospital. They simply go with their biometrics and they receive care. So Kenyans, make sure you enroll with the NHIF to ensure that you can be able to enjoy the 10 benefits we have mentioned, because NHIF, as we say, it is actually ni afya yetu, bima yetu. And we are saying that if you enroll with NHIF, you'll actually be able to access healthcare services without stress. And that is why currently we are saying ni afya yetu bila stress, where every Kenyan can be able to access quality healthcare services, the 10 benefits you have mentioned, conveniently, without facing any financial hardship. So Kenyans, rush. We have 156 service points in the country. We have 70 branch offices in every county we are present. We are present in every Huduma center in the country. And we also have 33 satellite offices, small offices in areas that they are remote, and Kenyans need to have the services as nearest to them as possible. You can also go to the social media. We are in Facebook, we are in Twitter, we are in LinkedIn, we are in TikTok, and you can also call a toll-free line 0800 720 601. I repeat again, 0800 720 601. So there are so many ways in which you can interact with Kenyans, so that you can be able to get all the information you need to enroll with the NHIF and ensure you and your family are covered and you don't face any financial hardship or incur out-of-pocket expenditure anytime you are seeking healthcare services. So it is up to you now to enroll. Thank you so much.
Bwana Mbogo Kariuki,
thank
you very much for making time to come and actually enlighten us on why it is very important to be part of the National Health Insurance Fund.
Thank you.
Well, there you have it, viewers. The message has been directed straight at you to be very keen, to be actually very alive to the fact that your health is an investment, and one that you need to be playing a very huge role in investing in. My name is Emmanuel Kutosi. Thank you so much. We have been with the head of the Department of Beneficiaries Management, that is Wambogo Kariuki, right here on the show to give us a very wide view on what benefits are there for you in being part of the NHIF in the journey towards universal health coverage. Thank you.
Thank you.
Linda familia na marafiki dhidi ya magonjwa.